Hi everyone, welcome to another edition of Moments with Lulu. If you're new to my channel, please go ahead and hit the subscribe button so you're getting notifications whenever I put up a new video. Today's video is going to be about clinical expectations. I'm excited about this video because this is what most nursing students are eager to know. Like, this is what most nursing students come to you and ask. Oh, what am I supposed to do in clinical? How is acute care like? And things like that. Like, especially if it's your first time or your first clinical experience, you want to know all of these things. Without further ado, let's get right into this video. The first point I'm going to be talking about today is scope of practice awareness. So as a nursing student, you want to know your scope of practice. It's very important because it's not everything you'll be able to do in your clinical placement, and there are some things that you'll be able to do at some point, like along the way as you go through the program or as you go through your clinical experience. So you always want to make sure that you're checking with your university, with your faculty especially, because irrespective of what the hospital or unit policy may be, your scope of practice is very important. You want to stick to what you're able to do and what the faculty has given you a check mark to go ahead and do it. So if you're not sure, your faculty should have a list of things you as a nursing student should be able to do in your clinical experience. So make sure you get familiar with that handbook. Always make sure you're sticking to your scope of practice as a nursing student. If you're confused or you're not sure, like, oh, what's my scope of practice? I don't know what I'm supposed to be doing and things like that. You want to make sure that you're reaching out to your instructor because you want to be safe as a nursing student. My second point is unit policy, procedures, and protocols. So if you're on a unit or in a clinical setting, like whatever clinical environment you're on or assigned to, you want to make sure that you are familiar with their policy. If you're not sure of what the unit policy or procedures or protocols or on how they do things, patient care, you want to make sure you're asking other nurses on the unit. You want to make sure that you're looking at their manual. If you're ever confused about anything, ask your instructor, ask the nurses on the unit. You can also ask the manager of that floor or of the unit you're on. They'll be able to help you and they'll be able to guide you. Irrespective of what you have been taught in school or in your nursing labs, some units may have a certain way of doing things which will not be so different from what you've been taught. You want to make sure that you're sticking to, stick with that policy, like the unit's policy and procedures and how they do things. If you're ever unsure of, oh, this is how I was taught in the lab and this is how this unit wants me to do it, ask your clinical instructor. Do not be afraid to reach out to your instructor or to reach out to other nurses on the unit if you're not exactly sure of how things are done. So the third point I'll be talking about here is how to be successful in clinical. What you're taught in school sometimes might seem really overwhelming, which is normal. It's okay because you're a new learner and it's your first time. Sometimes you're really nervous and you're agitated and things like that, you're scared, but that's okay. But you shouldn't let your fears and worries take the best of you. So what I'll say is very important in terms of patient care, because it doesn't really matter how much you've learned or how much you've studied before going to clinical. These are also important. But once it comes to patient care, patient relationship, it's very important to build a relationship with your patient, because you might have studied all the pharmacology in the world and you might have studied all the skills in the world. But if you're not having a good therapeutic relationship with your patient, that care is flawed. For me, what I'll say is, one, if you're a nursing student, do not leave care to healthcare aides or to nursing assistants, things like that. You want to make sure that you're doing your patient's care yourself. It will help you build a relationship with your patient. Whatever personal care you provide to your patient is very important, because at the end of the day, for example, if you don't bathe your patient, but let's say you've given them medication, you've done all the vital signs, you've documented everything, you've let the nurse know of all changes that has happened, and let's say your patient hasn't had their bath or they've not eaten, those little things, they're not comfortable. I mean, all those things you did, like all those nursing things you did, wouldn't make sense anymore because that person isn't happy. Your patient is right there. They want to be washed and things like that. So make sure that you know that you're doing these things, those personal things with your patient, because by doing this, you're with them in their vulnerability. So you're able to have a good conversation with them. So all those little things like you think don't matter, those are like the biggest thing. If you don't have that empathy and compassion within you to care for your patient, I mean, you have to like start afresh. So that's one very essential tip that has really worked, because it's just you're relating with human beings and you need to find a way to like connect with your patient. It's very important because when they're happy, they are more receptive to like everything you want to do for them. So just make sure that you're doing this and not leaving it to the healthcare aides or to the nursing assistants. Do it for your patients and do it to build a relationship with them. In terms of clinical expectations and how to be successful, make sure that you're abiding to confidentiality. It's very, very important. Don't go around discussing your patient with other healthcare providers that are not directly involved in your care. Don't do that. Like, it's not good. Whatever happens in clinical stays in clinical. Don't go around, don't go on the public transit like talking about things. Like sometimes you get carried away, but just make sure that you're being aware of the situation and being aware of the environment, so you're not like saying things you should probably not be saying. Another way to be successful in clinical is reports. So make sure that you're giving the right reports to the right people. When I say right people, your clinical instructor is one of those people. Like, make sure you're giving reports to your clinical instructor. Make sure that you're giving them reports every single time your patient situation changes, or you're probably going to another patient, or you're leaving the unit, or the clinical is over. So make sure you're constantly giving, because instructors, they really love that, trust me. And sometimes instructors will come around and ask you one or two questions, or like just want to know how your patient is doing or the updates on your patient. So just make sure you're always ready to give reports. Even if your instructors don't come to find you, go find them. That will give them the impression that, yeah, she knows or he knows what they are doing. So just make sure that you're reporting to the right people. Not just your clinical instructor, report to the primary nurse of that patient. Also, at some point in your clinical experience, you might have to report to other healthcare providers, maybe OT, your occupational therapist or physiotherapist, and the doctors as well. So you want to make sure that you're giving the right reports. If you're not sure of what you're reporting, you can go run it down. You can have a list of things you want to report. Go run it down with your clinical instructor or with the primary nurse of your patient, and they'll correct you as needed, and then for sure go ahead and give the report. Another point, like me, for those who are taking strictly fall and winter classes, like on a full course load, you have this long break before the next semester. So you want to make sure that you're practicing your nursing skills that you've learned previously. You want to make sure that you're practicing them, because you still need them. You need to take them along with you. You're reviewing materials, your medication calculation that you probably have forgotten, or you need some kind of practice, because practice makes perfect. Even if the semester is already on and you know that you have a patient for tomorrow, you want to make sure, and let's say you've done your patient research, okay, my patient has a G-tube, they have a trach and things like that. You want to make sure that you're reviewing the skills on how to care for a patient with a trach and things, and how to care for the trach itself. So you just want to make sure that you're reviewing those skills over like the day before or like the week before you're going to visit your patient, so you're not stuck. Also in clinical, another tip is if you're in clinical and let's say you want to insert an IV, for example. So if it's your first time probably, or your first time doing any kind of skill, you want to make sure that you're running over the steps with your instructor. So it's a learning environment, so you should feel safe. Like, that's the purpose of it. And if you're not, maybe you're not really comfortable with your instructor, That's okay. You cannot be comfortable with every instructor all the time. You can also meet the nurses on the unit, run over your skills with them. Like, it's fair, like it's okay to do that as well. And some instructors will also tell you it's okay to do that. Also, if you have an instructor, like every semester you want to know who your instructor is. You want to be familiar with your instructor, and it's very important when you're having an orientation. It's important to ask your instructor, what are your expectations of us? It's important. You have to set that point so that you know, like, this is what this instructor expects, this is what she doesn't want, this is what she can tolerate, and things like that. And in turn, also tell your instructor what you expect of him or her, because that's just how you both can survive in clinical. Like, you say what you expect of me and I'll tell you what I expect of you. It's a two-way thing. Like, it's about communication. If you're struggling or you're having any trouble, sometimes it's not easy to go to your instructor. I've also been in that situation where, you know, you're just probably scared. You can meet the other nurses, but again, your instructor is like your first point of contact. Like, no matter what, just try your best to, you know, take away all fears. Make sure you're prepared, because you just want to be prepared. It's okay to be anxious. It's your first time. Like, you'll be nervous. I've been nervous so many times, especially when you know someone is watching you, like an instructor is watching you, just to make sure that you're doing it correctly. Also, this is very important. If there's any instructor that is treating you in some kind of way, make sure that you're reporting that to your faculty. It's important, because this is not something you want to let slide. Like, I mean, it doesn't create a safe learning environment for you as a student. So if you feel like an instructor is like giving you some kind of treatment, you don't want to keep quiet if an instructor is treating you differently. You want to make sure that you're reporting this. Like, go talk to your faculty, because it's your education. We're all human beings at the end of the day. So if someone is treating you differently, you want to address it. If you cannot bring it up with the instructor, some instructors are open, like, oh, I just go like have a moment, or I'd like to talk to you about this. This is something I didn't really like, or I felt this kind of way when you said this or when you did this. Like, make sure you talk to the instructor. If you're not able to talk to the instructor, you can go talk to someone else, or talk to like anyone at all on the best way to like approach this situation. And if it's not working, go to your faculty. Like, they will surely address your concern. That's something that's very important to do. My last point on how to be successful in clinical is doing an effective patient research. I'm going to make a separate video like addressing an effective way to do your patient research that also like enhance your learning and critical thinking abilities. And maybe that'll come later in probably my next video or my next two videos. But I'm going to have a separate video addressing that, because you want to also go to clinical prepared. Your instructor will ask for that. They want to know what you know. Like, they want to assess your knowledge on your patients, on their pathophysiology, on the drugs they are taking as well. So it's very important you're doing an effective patient research. My last point is in this video is how to manage stressful situations in clinical. It's all about what works for you. It's all about you, because it's you who is in the experience. It's you who is going through that. I already mentioned this one. If an instructor is giving you a hard time in clinical, you want to speak up. Don't keep quiet about it, because it's going to be detrimental to your learning. Get adequate sleep. It's important, because that's the way you'll be able to function in clinical. Make sure you're getting adequate sleep. You're eating healthy meals. You're going to the gym. It's important. And also, you have fellow students in clinical, your colleagues. So make sure that you are reaching out to them, talk to them. If you're having any kind of clinical gathering, clinical get together, clinical eat out, clinical dine out, clinical whatever, like anything at all. And for all of you, make sure you're going to this, because it gives you the energy, it gives you the motivation you need to carry on. We've all had those moments. So make sure that, because sometimes it just gets really like stressful. So you don't want to go through that emotional part alone. So that's why you need to reach out to your fellow clinical groups. Like you need to bond with them because they get it. They understand it better than anyone else outside of your group. Trust me. Like even if you're not close, like if you don't have a close, something about nursing school and clinical is that in your first year you might not be close to a lot of people, but once you start your clinical experience and there's this small group of you, like there's this small 7 or 8 of you, and then you're going through something really stressful, or like you need someone, like you need help at the end of the day, whether you ask for it or not, you see yourself wanting help, and there's no other way of getting help other than calling on someone. If you're going to like turn your patients or to do morning care for your patients or things like that, you need someone. You just can't do it alone. So create that bond between and among all of you. Like it's important. Share your stories together. When it's time for debriefing, make sure that you're pouring out everything. Like if there's some way a patient spoke to you, or like someone was rude to you in clinical or things like that, it could be a patient, it could be a staff on unit, it could be anyone at all. You can tell, like report to your clinical instructor or like meet your fellow students. So it's very important you're reaching out to your fellow students, because yeah, that's how you survive, because no matter what, you're stuck with them for like the 4 years or 3 years of your program. Like you can't run away. So make sure you're reaching out to them. They perfectly understand you. It's a whole roller coaster. So just make sure that you're reaching out to these people. It's important. That's all I have to say. Talk to your family too. In as much as you're talking to your fellow students who are with you in the experience, you also want to make sure that you're talking to your family, because sometimes family means everything to you. Family means everything to some people. Like family is like the bedrock of so many people. So you also want to make sure that you're reaching out to your family for comfort, your loved ones, your friends as well. Reach out to these people because you need emotional support, that social support network. This is where it all comes. Like it's all about building a very strong social support. You just need to remember, like, take it slow. Sometimes you become really frustrated, like, oh, this is not working, like I don't know what I'm doing, I'm confused and things like that. But just take it easy. I need you to know that you're not in this alone. I still have 1 more year of nursing school to go, but I'm positive that it's going to be all right at the end of the day. Thank you all for watching today's video. I hope to see you all next week. Bye now.